Well, thanks for joining us. We've got two more presentations today. I want to introduce Abraham Homer from Children's Hospital, Colorado. And he represents, I think, a unique area within the space and has kind of been leading research and work and best practices in this area.
Hi, everyone. Thanks, Bob, for that intro. It's great to be here with you all. So my name is Abraham Homer. I'm the Gaming Technology Specialist at Children's Hospital, Colorado. I'm sure some of you, like I was many years ago, wondering what exactly is a Gaming Technology Specialist? Yeah, can you guys hear me now? Basically, in my role, I get to use different technologies like video games and virtual reality and augmented reality to help kids in the hospital. I also act as kind of a consultant to providers and clinicians who are interested in integrating this technology into their workflows and treatments. It's a relatively new role within pediatrics. It's slowly becoming established as a new specialty within the space. And it's spurred by a growing tech adoption within hospitals and a need specifically within pediatric hospitals for a kind of technical expertise around gaming technology, things like consoles, PCs, robotics, 3D printing, and of course, XR technology. So instead of me telling you kind of about what I do day to day, I'm going to let my cartoon twin appear, my virtual twin, you could say, kind of tell you about what I do and how my personal history and love of video games brought me to this important work.
Hi there, my name is Abraham, and I'm the Gaming Technology Specialist at Children's Hospital, Colorado in Denver. My job is to utilize various technologies, including video games, VR, 3D printing, and robotics, to help hospitalized kids and augment existing medical treatments. This includes things like using VR instead of anesthesia for procedures, administering AR interventions for bandage changes, facilitating telepresence robot visits for patients on isolation precautions, 3D printing custom adaptive solutions, as well as providing kids with games as a recreational distraction. And my passion for video games helped me get to where I am today. Eventually, it was time to head off to college, and there, I met other people who were as interested in gaming as I was, and that revered it as an art form as opposed to just a way to pass the time. This environment continued to expose me to the world-changing possibilities that gaming could have, and set me on a path to explore the ways in which video game technology could shape our lives for the better. Then one night, my senior year of college, I received a phone call from my sister, telling me that our mom was sick, and I needed to come home immediately. I jumped on a plane that night. Our mother had been diagnosed with stage 4 cancer and didn't have much time left, but she wasn't interested in staying at the hospital and wanted to spend her last days at home. So my sister and I took her back to her apartment and became her primary caregivers, staying with her 24 hours a day and doing our best to keep her comfortable. One evening, after my mom and sister had gone to bed, I went into the living room and began to play a video game to unwind. And honestly, this was the best I'd felt since my mom had gotten sick. And this was another light bulb moment for me. If it was helpful and therapeutic for me in this time of crisis, then it must be helpful and therapeutic for other people too. So I began using video games as a coping mechanism, and they helped give me the strength to take care of my mother when she needed it the most. And sometimes, when she was feeling well enough, my mom would even come sit next to me on the couch and watch me play like she'd done all those years before. Of course, this time commenting on Max Payne's fashion choices or swooning over Kratos, but it made me feel like a kid again. But a few weeks later, after a truly valiant and hard-fought battle, she passed away. After her death, I dove headfirst into researching ways that video games could be used therapeutically, and even began designing and developing my own video and VR games in hopes of providing others with the same relief that I experienced while caring for my mother. A few years later, I started hearing about how games were being incorporated into children's hospitals across the country, funded by awesome gaming charities like Child's Play and Gamers Outreach. And then I came across a job listing for a gaming technology specialist at Children's Hospital, Colorado. I thought to myself, this can't be real. It was the exact role I dreamed of. I went in for my first interview, and a few weeks later, I was starting my new career as one of the first gaming technology specialists. Throughout my journey as a gaming technology specialist, I continued to learn new things every day. But I always try to show everyone I work with how powerful, therapeutic, and transformational video games truly are.
So I hope that wasn't too sad to start my talk out with, but I like to share my personal history because it's a perfect example of how this technology that a lot of people think of as entertainment can actually change people's lives for the better and in their darkest moments. I could never do any of this work on my own. I am fortunate enough to be part of an amazing group of people. We call ourselves the Extended Realities Program, or XRP. And this is an interdisciplinary working group comprised of child life specialists who are in charge of the social and emotional well-being of kids while at the hospital, as well as doctors, nurses, researchers, and subject matter experts like myself. This slide is a little outdated, actually. A few months ago, we just hired an in-house AR/VR developer to help us create in-house software, which is pretty amazing. So this group essentially acts as an advisory group to anyone in the hospital who's interested in bringing XR tech into their workflow, into their specialty, or just want to learn more about it. So, how do pediatric hospitals use XR technology? As we all know in this room, the use cases for XR in healthcare are numerous and growing every day. At Children's Colorado, we use XR in various clinical and non-clinical ways to serve our patients and families. There isn't a huge precedent for this work, particularly in pediatrics, and we're continuously working and collaborating with other hospitals and other game techs across the country and world to kind of provide a roadmap and a best practices for how to administer this technology in efficient and safe ways to kids, while also considering logistical things like device management, infection control, patient information security, and of course, staff training. So this is a list of some of the most common use cases in pediatrics. This is what we mostly use XR technology for at Children's Colorado. One of the great things about using XR in children's hospitals is the need for recreational play. It kind of sets children's hospitals apart from adult facilities. There's numerous research studies that show that kids who are able to engage in play while at the hospital heal much quicker and have greater clinical outcomes, not only as a child, but as they grow up into adults as well. So we really try to foster this notion of play with all of our patients. We have playrooms across the hospital set up with different VR sets so kids can go in, engage with them, play with them, get to know them. I'm also able to do one-on-one sessions, and I can go to the kids' rooms and do a one-on-one VR session. This is a picture of one of my long-term patients who actually really looks forward to coming to the hospital because he knows that's where he gets to play VR, which is pretty cool. We, of course, use it for pain management. We use it for post-op pain, chronic pain, procedural pain like needle pokes, IV starts, vaccines, that kind of stuff. And the cool thing we're able to do is we can actually integrate the need for VR pain management into what we call adaptive care plans, or ACPs. So whenever a kid comes in and has particular needs, if they get overwhelmed in certain environments, if they don't want a certain number of staff in their room, we can put that into their medical record. So every time they come back to the hospital, we know that they don't like to be in this certain environment, or that they really like to use VR for pain management, so we can keep that going through their whole hospital journey. We use a lot for procedural preparation and support. So we have 360 videos that actually kids can go into in a VR headset and experience what it's like to do a procedure. For example, we have one in our operating room where kids can put on a VR headset and embody a patient that's going through the whole process of checking into the hospital, changing into their gown, transferring to a bed, into the OR, getting anesthesia, and then waking up after the surgery. Kids are able to experience these before they actually go and do it in person, and it really helps mitigate that anxiety they feel when going to the hospital. I'll show a few examples of procedural support a little bit later. We also use it for PT and OT. VR is great for engaging the whole body, obviously, and we're able to augment these different physical therapy treatments. We also use things like hand tracking for occupational therapy to help strengthen fine motor skills or just get hand strength back into kids. One of my favorite use cases is art therapy. I come from an arts background, so I love to see the art pieces that these kids make in VR. We use off-the-shelf virtual reality art applications. And we can use a multimodal approach where kids can actually make things in their sessions, and then we can 3D print them a physical object that they can take home and kind of close that conceptual loop for them after their sessions. We use relaxation, mindfulness. There's lots of examples of that at the conference here. And we also use social VR for sibling visits and for support groups. During COVID, our visitor restrictions were pretty strict, so siblings were not able to come and visit patients, which was really hard for them. So we were able to utilize social VR to have kids interact with their patients and families. We also use it for support groups. We've done support groups for cystic fibrosis patients. The very nature of that disease requires them to be isolated for the whole duration of their hospital stay, which can be really lonely. So we can put them in social VR contexts where they can meet kids with the same experience, the same diagnoses, make friends, and it really cuts down on that effect of isolation on them. So when using all this technology, we really need to create a kind of a guideline for staff so we can administer this technology in a safe way every single time. So we developed this VR assessment tool as a kind of guideline. Essentially, we ask these 6 questions to parents, caregivers, or patient if they're able to answer. And essentially, if they answer yes to any of these questions, they become disqualified from using VR. And it's standard things like history of seizures, do you get nauseous, are you claustrophobic, things like that. But I want to reiterate, it is just a guideline. There are extenuating circumstances where a kid would answer yes to one of these, but still could greatly benefit from using virtual reality. You can see in the picture here, that's me working with a patient in a surgical halo that's screwed into his skull. And if we asked question number 2, we'd most likely answer yes, which would traditionally disqualify him from using VR. This kid, however, was having a really hard time engaging with his therapies and loved trains. So I thought, maybe we can use VR as an incentive for this kid to engage with his therapies. So after consulting with his doctors and his physical therapy team, we said, let's give it a try. So we used an Oculus Go with a modified strap. We loaded it up with 360 videos of train trips across the Swiss Alps from the perspective of the conductor, which was really cool. The first time we put the headset on the kid, he was absolutely ecstatic. We did not see him as happy as he was when he was doing that. And after that, not only did he engage in his therapies and surpass the progress that his therapist wanted him to get to, but he was excited about doing his therapies because he knew that if he did his therapies, he could do virtual reality and go on these amazing train trips. So I'm going to show an example of a procedural support. This is a patient named Ashley who uses virtual reality instead of anesthesia for her lumbar punctures.
My name is Ashley. I was diagnosed with acute lymphoblastic leukemia in May of 2016. Treatment, right now I go once a month, and every 3 months I get a lumbar puncture. A lumbar puncture is when I get chemo in my back through a needle. I've gotten this procedure done so many times I can't even count. Typically for these procedures I get anesthesia. With the anesthesia I can't eat the morning of. Also, it makes me feel groggy afterwards and it gives me headaches. One procedure when I was supposed to get anesthesia, they presented the idea that I could do virtual reality instead. I decided to try virtual reality and the benefits were really nice. I didn't have a headache afterwards and I could eat and I wasn't groggy at all. During the procedure, virtual reality gave me a distraction to the pain and was able to help my pain management. For future, I would definitely do virtual reality again because the benefits are great and I really hope that other patients and families can use this benefit in the future.
So I'm happy to say that Ashley is now cancer-free, and she has become an amazing advocate. Yeah, amazing. That's so awesome. She did the last about year and a half of her lumbar punctures using strictly VR without any anesthesia, which is pretty amazing. And she's become an amazing patient advocate for us for kids to use virtual reality instead of anesthesia for that particular procedure. I'm going to show one other video about another procedural support.
Pain is much more complicated than people give it credit for. You think you either have pain or you don't. Interfering with the child's receptors for pain, interacting with the way that the nerves are conducting pain to and from the brain. It's not that we are simply distracting you from the pain. With virtual reality, you truly aren't experiencing it.
I want to be a horse trainer, but I mainly want to be a pediatric oncologist. I just really want to help more kids get better and live a full life. When I was really little, they diagnosed me with an autoimmune digestive disease.
In the first year of her diagnosis, she had 4 endoscopies under general anesthesia.
There are risks that come along with general anesthesia.
All right, Miss Kyla, we're going to get started.
In Kyla's case, she's using virtual reality in place of general anesthesia to successfully tolerate her endoscopies. The impact of the child's life in that situation is profound.
Doing great, Kyla. I get the VR goggles and the numbing medicine. There's a little tube that goes down your esophagus, and they do it super fast. My last one was like 3 minutes.
How does virtual reality work to reduce pain? The more I can engage you in that virtual experience, the less your brain is able to perceive the pain signals, and they might as well not exist.
She doesn't dread going to the hospital anymore, and neither do I. It's been an amazing change in the management of her condition for us.
Good girl.
So that was a shorter piece of a longer documentary that we made with the lovely folks at Lenovo. If you want to see the full thing, you can see it on their YouTube channel. I'm going to quickly run through the rest of my presentation with the 2 minutes I have left. So now that we know how pediatric hospitals use XR tech, what can developers do to help make these experiences for pediatrics? So this is what I call my prerequisites for pediatric VR. These are the 6 things that we look for whenever we're developing experiences in-house or working with outside developers. The first one is accessibility, or what we like to refer to as flexible control schemes. Now, it's important to consider when you're making things for pediatrics, not every kid is going to be able to engage with the experience in the traditional way. Some kids might not have use of both of their hands. Some kids might not be able to get out of bed. So we need to be able to accommodate those mobility restrictions through different ways of controlling the experience. This could be head movement controls, just one controller control, gaze-based control, voice control. But it's important to understand that these mobility restrictions are and to design around them. The other one is vertical reorientation. So that's reorienting on the vertical axes. We saw with Ashley, she, during her lumbar punctures, had to keep her head between her legs, which is a really weird way to do VR, but you have to be able to reorient on that axis in order to accommodate that procedure. Mirroring, of course, is really important. The provider needs to be able to see what the kids are seeing so they can help them through the experience. No-fail gameplay. We don't want to be punitive with these kids. We don't want to punish them for engaging in VR treatments. We want to encourage this notion of progression. In traditional games, it's either you win or you lose, but instead, we want them to be encouraged to progress and not be punished. Choice. Kids at the hospital are stripped of their choices every day. They don't get to choose to be at the hospital. They don't get to choose when to do their medication, all that stuff. The more choice you can incorporate, avatar choice, environment choice, music choice, the better, the more agency that they'll have in the experience. Difficulty modification is important as well. Traditionally, we have easy, medium, and hard. However, we kind of need a little bit of more nuance. When we can, we try and give the difficulty control to the provider, especially in things like physical therapy. If a kid is struggling or not engaging enough, the provider can kind of modulate that difficulty as needed. So as a developer, it's important to get to know your use case and your user, do research, ask questions, understand the procedures that you're designing for, and understand the equipment that is used in those procedures. You want to design to augment these procedures. You don't want to design things that hinder the procedures. Understand the physical and the psychological constraints of your end users, of the patients. Again, kids won't be able to traditionally engage with VR with 2 hands even, and psychological states, we don't want to exacerbate the trauma that kids are having. So if a kid is in the hospital for a motor vehicle accident, we don't want to put them in an experience where they're in a car, crashing cars, etc. And of course, while kids have specific treatment goals, they still want to have fun. Your experience needs to be fun, and that's a really interesting challenge to overcome. Finally, utilize patients in your development cycles. Use them as early as possible. You have your end users right there. Use them to help storyboards. Use them to help create assets. Use them to figure out the aesthetic of your experience. And of course, you should use them in your beta and alpha testing cycles. This will give the kids so much more agency over their hospital experience, and I guarantee you it'll help you make a better XR experience in the end. So I just want to leave you with one resource. This is the VR Clinical Outcomes Research Experts Model, created by an amazing group of doctors and researchers. We utilize this in our development pipeline, and we kind of retrofit it onto a traditional pipeline, and it helps us bridge the gap between traditional game development and research within healthcare. And with that, I say thank you.
So Abe, we've got time for about 2 questions. I'm going to give you one. I found pretty interesting that I didn't really think about before how unique some of the games or the application needs to be based on the procedure. Based on your experience, do you think it's how very specific does the developer thinking about a game need to be? I mean, do they need to approach each different procedure very on its own and not try to make one thing that takes care of 3 procedures or something like that?
That's a great question. It kind of depends, especially with like the flexible control schemes. So for example, Kayla, who got the transnasal endoscopies, that procedure requires her to keep her head really, really still. So she needs to be able to control it with a touchpad on the controller with her thumb. You could use that same experience for something like an IV start or a vaccination that requires you to keep your arms really, really still, but still control that same experience with head movement. So by incorporating the accessibility of flexible control schemes, you can have a single experience be applied to a bunch of different use cases, but it really depends on the use case. Some need that degree of specificity.
Thanks very much.
Thank you.